medicines are those that don't do what they are claimed to do. Dr. Levy calls this entire category of medical therapies placebo medicines. Examples include chiropractic care, where you can treat cancer by adjusting your spine; cupping, where you can improve an illness by warming up some cups and placing them on the skin, which causes the skin to be sucked up into the cup; and iridology, in which measurements of the colored part of the eye predict future illness. My name is True Levy, and I'm going to interview neuroscientist Dr. Morgan Levy in order to understand why people believe in placebo medicine. Why do people believe in placebo medicine, and how come these treatments seem so real?
Well, it has to do with how human brains are programmed and what kind of information humans are prepared to understand. People who market products know exactly what I'm talking about. Anyone in the marketing profession will tell you to package your product in a way that the human brain will accept your message, right? They will tell you that presenting your product in the most logical way is just not going to work. A seductive woman wearing black will sell perfume better than a bar graph depicting fragrance molecules, right?
What do you mean by our brains are programmed?
When I say that our brains are programmed, I'm using an analogy to the computer. You know that for a computer to work properly, you must use programs that are compatible. Similarly, if you plan on using your brain, you need to employ compatible software programs. Programs and operating systems evolve through upgrade after upgrade, and you need to make sure that you have the current editions that are compatible. Programs that are compatible with the human brain include things like religion, war, sex, and placebo medicine. I am sure that you have seen advertisements for placebo medicines that were crafted to be compatible with your brain's programming. For example, I saw an ad on television yesterday about a pair of Tommy copper woven gloves that will cure your arthritis. The ad was just filled with ideas that are compatible with the human brain and how it's programmed.
Are there programs that are not compatible with the human brain?
Well, of course. Some of them include relativity, evolution, global warming, macroeconomics, genetics, stem cell research, and of course, medicine, regular medicine. Logic is a program that is not fully compatible with the human brain, as it is relatively recently evolved. You may note that it takes a lot of hard work for a human brain to use this program. Most people can't even do it very well, even after they've learned it. And it can be easily taken offline by fatigue or intoxication or anger. Older programs like sex and war have undergone numerous upgrades and tend to be more resilient. It is not easy to cause a man's sex drive, for example, or fight reflex to be taken offline. Most people have a sense that they are being logical and that others, are not. What people are really doing is using another program that is compatible with the human brain, and this program is called post hoc rationalization. This is a classic logical fallacy, of course, in which you make up a reason for an observation after the fact. The way we use it is we see something and we feel something in our gut, and then we make up a rationalization to explain what we saw. If it was something that made you feel good in your gut, then you make up a reason why this thing is good. If it was something that made you feel bad in your gut, then you make up a reason why this particular thing is not so good. Post hoc rationalization is our default way of thinking.
How does that work?
I have a 4,000-year-old treatment that is a secret formula, and Joe says it works great. And it is all natural, and not like those processed medicines that the big pharmaceutical companies want to sell you. And I show you a nice butt, and voila, you are likely to buy what I am selling. I am telling you what you are prepared to hear due to the way your brain is programmed. Our brains are programmed to easily understand certain kinds of information and to have difficulty understanding certain other kinds of information. This kind of brain function is common throughout the animal kingdom. For example, dogs have brains that are programmed to eat meat, sleep, have sex, chase rabbits, be trained and be loyal, of course, and to sniff other dogs' butts. Can you imagine a horny male dog deciding not to hump another male dog because it would be unnatural?
But humans do all kinds of things that our brains are not programmed to do.
Yes. You see, logic has helped us to survive a little recently, and it has made it possible for us to change faster than evolution is capable of by allowing us to change by going outside of our programming and altering our own behavior. When we started living in large farming societies, we made up rules so that we could all live together peaceably. Let me say it this way. It was lucky that we could do that. Still, logic is not our default program. It would not be a type of thinking that would have resulted in our survival. When we were hunters and gatherers, in order to do logic, you must have accurate intelligence. Without accurate intelligence, your logical conclusions will be incorrect. And it is, of course, not possible to have accurate intelligence about most things in nature. Post hoc rationalization does not require accurate intelligence. Although it is a classic logical fallacy, it is actually a pretty smart way to think for a species that wants to survive. In order to survive, a species will rely on its innate impulses, its experience, and a rationalization of events that provides the best odds of survival. I want to emphasize that the way human brains think is smart, but not logical. There is a program called intuition, for example, that comes standard in every human brain. It synthesizes sensory input with emotional content, topped off with some rationalization, to produce a quick response that has good odds of resulting in survival. You might say, I had a gut instinct, or I had an intuition.
How do you really know what treatments are real and which ones are fake?
Well, in modern medicine, new treatments are discovered using the scientific method. First, you ask a question such as, does acupuncture treat medical illness? Then you make a testable hypothesis. I think that acupuncture treats colon cancer. Then you make a prediction such as needle placement in the center of the right buttocks will cure cancer. Then you do an experiment such as I will treat 10 people that have colon cancer with a needle and in the center of the right buttocks, and they will survive significantly longer than 10 people who I treat with a fake needle. Then you analyze the results of the experiment and draw a conclusion. In this case, there was no statistically significant difference between the treatment group and the control group. Your conclusion, acupuncture performed in the right buttocks does not alter the outcome of colon cancer. Now, of course, it will take a large number of studies like this one in order to conclude that acupuncture does or does not treat any medical illness. Well, it turns out that a large number of studies have been done, and we can conclude that acupuncture treats pain, nausea, and psychosomatic illness, but it doesn't treat things like infections and cancer, etc., etc. We can also conclude that the curative agent is suggestion, and that things like needle placement really don't matter. Now, this is not the traditional way that humans have determined what treatments work. Over the centuries, people would see illness come on and go away, and they would make up some rationalization about what made it go away. They would communicate this knowledge to other humans using the correct programming language so that they could convince others that they were correct. That is how the ancient Chinese came up with acupuncture.
I've heard that ear candling can create a low-level vacuum that can suck wax and other debris out of your frontal sinuses, resulting in a general improvement in health. Is this true?
Well, ear candling is a purported medical therapy where you place a lit candle in the patient's ear and drip hot wax into the ear canal. Consider that I'm asking a person to ignore their gut feeling that ear candling is a reasonable medical treatment and to think logically about the fact that, there's a tympanic membrane between the outer and middle ear. I mean, there is zero possibility that ear candling can have any effect on the brain unless you actually burn a hole in the tympanic membrane, but that would be a really bad thing.
Are people who believe in ear candling just stupid?
Well, IQ is not the issue. They understand what I am saying, but their sense that ear candling might work is very strong. Even the sound of the words ear candling makes them feel good in their gut. The idea that there's an anatomical barrier between the wax and the brain is just not something they can see, and it doesn't feel good in their gut. It is really hard to get them to give up this idea.
Is that the only reason people believe in placebo medicine?
No. Another reason that people believe is that placebo medicine actually works. Not in the way it is claimed to work, but it works nevertheless. Now, there are a variety of reasons why it works. For example, the natural course of most illnesses is to improve. People often have a desire to please an authority figure, so they often exaggerate improvement. Or expectation of an improvement can cause a patient to think that an improvement happened when none did. Also, you could have unseen or unknown events that cause the patient to misperceive that something therapeutic has occurred, or unseen or unknown events that actually was the reason that the patient got better, and the patient, thought something else was the reason they got better. Now, these are examples of placebo medicine working by deception or misperception, but there is one additional reason why it might work that is actually related to real physiologic effect. The power of suggestion can cause real changes in brain chemicals called neurotransmitters that can have a compensatory effect on your physiology. Now, you can treat pain and nausea pretty well with most placebo treatments because suggestion can cause the release, for example, of endorphins. Sleep and anxiety and a few other compensatory physiologic phenomena may also be improved in this way. Thus, suggestion can trigger one of our innate mechanisms for ameliorating injury, but it cannot kill bacteria or get rid of cancer cells or heal broken bones. Because placebo medicines can do this, it is easy to convince people that they can do more. This is what I mean when I say placebo medicine works, but not in the way it is advertised. Some people believe that placebo medicine does everything as advertised, because it's a $1 trillion per year industry. If you can make money because you believe something, then you will have a high likelihood of continuing to believe that something. Another reason is that people believe in placebo medicine is that the human brain is programmed to continue believing what it's already believing. Humans tend to be hard-headed. It is very difficult to get us to change our opinion or think outside of the box. Empirical evidence often fails to change the opinion of a human. I saw an article yesterday. It said 1 in every 5 Americans believe that the sun actually is in orbit around the earth. Really? Well, my guess as to why we evolved hard-headedness is that things that have worked in the past frequently, work again in the future. Sticking with our routines probably gives us some survival advantage. Being hard-headed may increase our odds of survival. Another good reason to believe in placebo medicine is that the alternative really sucks. We are a frail little species that has little control over anything, and we live in a dangerous environment. No matter what we do, we will suffer and suffer and suffer and die. We desperately want there to be some hope that we can be cured, and maybe even that everything will be okay and we won't die. I would rather believe a bald-faced lie about a cure than face a cold, hard reality. Maybe those of our ancestors that were less able to believe like this were tormented to the point of making survival more difficult. For whatever reason, evolution favored those who blindly believe. And finally, I just want to say, skeptics usually think that people who believe in fake medicine are just stupid. That is inaccurate based on this essay. Why don't we turn the tables on skeptics and ask, why is it that skeptics believe inaccurate things about people who believe in placebo medicine?